Started with a few brief announcements while everyone's still coming in from the wait room. So again, thank you so much for joining us today for our November call. I have a few brief announcements to share, and then we will move on into our presentations. First of all, I did just want to thank everyone for joining us today, for doing the work that you all do. Just a note that, obviously, we may have some changes coming our way in the future, and we will just continue to work together as a community to support the needs of residents in Montgomery County that are experiencing food insecurity. And so I just ask you all, especially those of you, working on the ground day to day, please feel free, to share your concerns in these spaces, share with us changes, if any, that you see in terms of levels of people experiencing food insecurity, seeking services, and what we can do together as a community to address those needs. So thanks for joining us. I did also want to, I'm sorry, did someone have a question? Nope, okay, great. Again, if you could just share your name and organization in the chat. Beta, I will ask you to share today's agenda in the chat. Also, just a food council announcement that we will be having our Moco Made Mixer on this Thursday, November 14th, from 4 to 6 p.m. at Baby Cat Brewery. We will share a registration link for that in the chat. Hope to see some of you there in person if you are able to join. I did also want to share a quick update from the Holiday Giving Program. They have currently matched more than 10,000 families for Thanksgiving food packages this year, but they still have a little over 600 families that are unmatched in specific zip codes. If your organization is able to pick up any additional families, or you would like additional details about a specific area, I'm going to put that information in the chat, how you can reach out to the Holiday Giving Project, and a note on the zip codes as to where they are seeing the most shortages. The largest number I can say is in some Silver Spring zip codes. So we will be sharing that in the chat for you. And the last item I wanted to raise here, and I will try to remember to do it again later for those that join a little later, just a crowdsourcing question for you. If any of the food assistance providers on the call are sourcing produce boxes from organizations other than the Capital Area Food Bank or the SHARE network, if you wouldn't mind naming that organization in the chat and letting me know what organization you are with, and we will be following up to get that information. This is just a resource that we want to start pulling together for providers. So if you have any leads, again, this is for pre-packed boxes of produce that is not coming from the Capital Area Food Bank or the SHARE network. We would love to collect that information. Okay. That being said, I see some of our speakers joining us. I see Cece from Capital Area Food Bank, and I believe that I saw, there's Marion, great. I don't know who's going to be kicking us off, but I will make a few folks co-hosts. So you have Michelle, I see you there too. So I am going to turn it over to the Senior Nutrition Strategies Program at Capital Area Food Bank. Thanks for joining us today.
You're welcome. I'm going to kick things off. So do I have sharing abilities?
Yes, you do.
Okay, awesome. Good afternoon, everybody. Can everybody see the PowerPoint?
Yes, you are good, Marion.
Awesome, awesome. And I think I need to do this in presentation mode. Somebody's getting rid of it. Okay. So I'm going to stick things off. I'm Marion Barton Peel. I'm the Senior Director of Senior Handler Strategies at the Calvert Area Food Bank. And it's so nice to be here with you today. We're just going to give you an overview of our department at CAFB and then take some questions later. And so I'm going to start things off just to give you an overview of the department. This is using slideshow, so. Did it change? So I can't see it for some reason.
Oh, yep, we're moving through a few slides. so-
Okay, all right. Let me go back. All right, this is the slide I want you to see.
Yes.
So we have two major programs that we oversee at CAFB for the Senior Hunger Strategies Department. One is the Commodity Supplemental Food Program, and that is a federal program that goes by a few different names depending on the state. It's a federal program that provides monthly groceries of mostly shelf-stable commodities to folks who are 60 and over. In DC, the program is called Grocery Plus, and in Maryland, it's called My Groceries to Go. You'll hear a little bit more about that program from Michelle Larson. And then the Senior Brown Bag Program is also a monthly distribution of commodity foods, mostly T-fat foods. We also add in some donated product when we can, as well as some purchased products, but very rarely. But mostly T-fat goods. And this program is for adults 55 and over. Now, it just so happens that I started this program, I think back in 2002. So it needs a refresh, and that's what we're doing. We're calling this a Senior Brown Bag Evolution. So you'll hear about the evolution process where we are testing two pilots. One is called Senior Choice, and the other is called Silver Market. And you'll be hearing more about that from CC Chisholm. Just want to give you an idea of our team. We are a team of 16 folks at the food bank, and but particularly for Maryland, we have a truck driver, Trovon Moore. You can see his name highlighted in yellow there. He handles mostly our Maryland deliveries. Our general drivers also deliver in Maryland too, but Trovon is our driver for Maryland. That's on our team. And then we have a new Maryland Partnership Coordinator. His name is Gus Paz. He's not on the call today, but he just started. He took over for Anthony Evans, who transitioned to another department here at the food bank. But Gus has been with our team for about 4 years. And so we're happy to transition him to the Maryland Partnership Coordinator. And that's for the My Groceries to Go program. And then last but not least is CC Chisholm. And she is the partnership coordinator for the Senior Brown Bag Program. And like I said, you'll be hearing from CC a little bit later. And they are supported by the two managers, Michelle Larson, who's on the call, as well as Wendy Wine. I believe Wendy's on the call. She was on PTO, but she's back and on the call today, but I don't see her. All right, so that's our team, a little bit about our team. Just want to tell you about funding, you know, how these programs are funded. For CFSP, we receive annual reimbursement of $86.16 per participant. And that's about $7.18 each month. In DC, we have $410,000 in local funds that support that, and $515,000 in federal funds. And then we need to update this, but we received a grant from the LFPA, so another federal program, and $156,000 our first year. This year we only got $76,000 out, so that number needs to be updated. We also received $32,000 in the Seniors Farmers Market Nutrition Program. I'll let Michelle tell you that's a unique feature of the Grocery Plus CFSP program in DC. And then the Washington Home is a private foundation in DC, and we received $263,000 from them. Mostly they provide us with fresh produce, as well as they fund meetings, and they funded a van in the past. You can see a picture of the van, and those are some of the board members and the president of Washington Home, as well as our CEO, in funding the van at our conference that they also funded. But in Maryland, we receive for CFSP or My Groceries Go, we receive about $112,000 in federal funds, and then in local funds, state funds, $300,000. That's primarily for fresh produce, and we are doing those produce boxes for all of our My Groceries to Go participants, as well as our senior brown bag participants. And then we receive from Montgomery County $45,000 in local funds. So I'm going to go ahead and pass this over to Michelle, and I guess I need to go ahead and be the person that does the slide. So Michelle, let me know when you want to go to the next slide.
Okay, thank you, Marian.
Thank you.
Again, I am Michelle Larson. I am the Senior Manager for the Senior Hunger Strategies Department, working with primarily the CSFP programs. We currently are in DC serving the entire caseload, and caseload, when we talk about CSFP, means the maximum number of seniors that we can serve each month. And then we also do the program in Maryland, in Montgomery County, and also in Prince George's County, and we are waiting caseload to expand to Northern Virginia as well. So just to give you a little rundown, some of this may be familiar to you if you were on the call last year, but this is the current eligibility guidelines for Commodity Supplemental Food Program. So it is an enrolled program, and it is the only USDA program specifically for seniors only. So a person needs to be 60 or over. There's a residential requirement. So for residents of DC, they can be eligible for the DC program, and that is locally known as Grocery Plus. If they're a resident of Maryland, in Montgomery or Prince George's County, where we serve, they are eligible for the Maryland program, which is called My Groceries to Go. And then they have to not exceed the federal income guidelines for this program. It is currently 130% of the federal poverty level, but I will share in a few slides some positive changes and updates from USDA regarding that. But we'll go on to the next slide. So what is included in the box, Marian, as she mentioned earlier, that it is mostly shelf-stable items, but these are the categories that we always have to include to ensure that it is a complete box. So there's juice that can be 1 or 2 items of juice, meat proteins that could include beef, chicken, salmon, or tuna, plant-based protein, which could be dry or canned beans, lentils, or peanut butter, vegetables, fruit, grains, cereals that could be hot or cold cereals, milk, and cheese. And then each of our boxes every month does include some piece of nutrition education resource, either to promote the use of the items in the box or just special nutrition needs for the senior population. And you can go on to the next slide. So our current reach for CSFP, each box includes about 24 meals per month. So it's obviously not enough for a senior's entire month of food that they need, but it is a supplement, and it is a substantial supplement. And we have seen, in recent years that seniors really depend on this box that are enrolled in our programs. Currently, between all of our regions that we serve over 7,000 seniors each month. In DC, our caseload is 5,730. And then our caseload in Maryland is 1,300, and that's split up between Montgomery and Prince George's County, roughly split evenly. And then you can see below that these are the sites where we currently are serving. And I actually saw maybe one of our site leaders actually on the call today. So we mostly are at residential sites, but I did want to point out for this group that we do have 2 community sites, Holiday Park Senior Center and the White Oak Senior Center, where our staff are running those distributions, and anybody that is in the nearby area could come to those distributions, sign up and receive their first box at that point. And those are done through the parking lot. You can actually see in this picture to the right, the top one, that was our former partnership coordinator, Anthony. I think that picture was taken during COVID, him helping some seniors out at the Holiday Park Senior Center distribution. And then we've also recently added a home delivery program to our Maryland program, and that is for us to truly serve the homebound seniors, so seniors that may not be able to get to any of the locations, also don't live in one of our residential sites where we're currently doing the distribution, and also don't have any support like a proxy that could pick up on their behalf. You can go to the next slide. So I just want to talk a little bit about value added, what we add to our senior programs. Marian mentioned this briefly, but the one unique thing about our DC program is that when a senior enrolls into the Grocery Plus program, which is that local name for CSFP and DC, they're actually automatically enrolling into 2 federal programs. One is the Senior Farmers Market Nutrition Program, and the second is the Commodity Supplemental Food Program. So not only are they getting that automatic monthly box when they enroll and are eligible for the program, but then when the Senior Farmers Market Nutrition Program season comes up, then they automatically get those benefits. And we actually partner in DC with Fresh Farm, and they help us distribute electronic cards to those seniors, and they get those maximum benefit of $50 per season. So this is the last month that our seniors can use that benefit until next year. So we're really excited about that. And honestly, it would be great if we could combine that also in Maryland. So we are advocating for that also on a state level to have Maryland combine those programs as well. Another value added is we do partner with DoorDash, and that is how we serve our homebound seniors in all of our regions for CSFP, and also any gap deliveries. If a senior has an emergency, so for some reason they can't make it to their regular distribution, we do offer gap deliveries or courtesy deliveries to those seniors when there are availabilities in our caseload to do that each month. Another is, if you look at the picture on the top right corner, there's a picture of some seniors holding a produce box. And Marie, you were just talking about the produce boxes, and those are the produce boxes that we have been giving out. We started this last year when we received funding from Maryland DHS, and we just got approval to start purchasing those again for this grant year. So I was just at a distribution this morning, and those seniors were very excited to see those produce boxes back again. But it's about a little less than 8 pounds of produce right there. But what's great about those produce boxes for seniors is it's in smaller quantities, and it's very manageable for them. So instead of at the food bank, we do a lot of bulk produce purchasing, but this actually is a lot more consumable for our senior population. So they're really very popular, and we're excited to be able to have funding to add to the boxes, because produce is one of the most requested items from seniors. And because CSFP is very restrictive with shelf-stable items, it's nice that we are able to secure some extra funding to be able to provide that. We also, as Marian mentioned before, that we have an LFPA grant in DC, where our state agency, DC Health, helped us secure that. And we work with Dreaming Out Loud, which is a local producer and kind of conglomerate of minority-owned farmers to source their produce and get that out. So as you see in the bottom right corner, that were some peppers that was distributed through our pilot of Silver Market at UPO PD Green Center, and Cece will talk about that in a little bit. But we've been able to help purchase produce for locally sourced produce, which has been exciting for us too. And as Marion mentioned, we also have the Washington Home Grant, which is also serving DC seniors in a variety of ways, including produce, marketing. We're able to get the word out more about our senior programs. And then, as Marion mentioned, we had a senior hunger conference, and we were able to also purchase a van to make home deliveries. You can go to the next slide. So as I mentioned before, there are some changes, exciting changes, positive changes with the USDA food distribution programs. For some of you that may know or in the policy space, back in 2023, there was a proposed rule change that was released from the USDA, and they asked for feedback from other states and local agencies that were running these programs. And really the focus was on improving access and parity. They're really trying to break down barriers and create more equity among the programs. So the final rule was just announced in October 2024. So just last month. I only highlighted a few changes. There are more, and you could go to their website. It is posted for the public. Some of these changes will not go into effect until next year, but these ones that are listed here, especially the income ones, you will see changes starting as soon as December of this year. So one big change is that USDA is moving away from using the word commodities, which is kind of funny because CSFP is still CSFP, which the word commodities is in that. But if you see in the upper right corner, that's their new little logo that they're using, that USDA foods is the new term. So if you start seeing that in publications or anything, that's still kind of referencing the same thing. It's not anything new. They're just trying to update their terminology. With CSFP, the most positive big change right now is the increase from 130% to 150% of the federal poverty guidelines, which is very exciting. There was a proposed rule for up to 185%, but that didn't actually make the cut. But it is a positive change in the right direction that we feel we support this change, and we're excited to implement this change starting in December. And then the other big change that we hope that our states will actually follow through with is that they may choose to write into their state plans to allow participants to become income eligible for CSFP through other federal programs such as SNAP. So if somebody is already enrolled in SNAP, they could also be eligible for CSFP, and vice versa. But that does have to be written into state plans, and we're kind of at the mercy of the states. So we hope that Maryland and DC and Virginia all do support that as well. And then the biggest change with TFAP is that all states are going to have the income guidelines be set at or above 185% of the federal poverty guidelines, which is a big increase for some states. I believe the stuff I was reading recently said that the highest the income could be was 300%, but that states would have to put that in their state plans for TFAP. And so, like I said, these implementing changes will happen around next month, by the end of the month, before 2025, calendar year 2025. But we're excited, and once we do have these new changes, we definitely will share it out with this group and with everyone. And we hope that we will have your support to promote the program that now, especially with CSFP, we're going to see a lot more seniors eligible for this program. So it's definitely a positive change. That's all I have to share. I'm going to pass it over to Cece, and she's going to share a little bit about Senior Brown Bag and all of the fun, exciting new things happening there.
Thanks, Michelle. Yes, so I'm going to talk a little bit about Senior Brown Bag. We very often work with our CSFP program in DC and Maryland. We have some overlapping sites. I saw Lourdes and Edgar from the Charter House on the call today. Hi, folks. Nice to see you. They're one of our, they're some of our site leaders at one of our programs in MoCo. But yeah, I'm going to talk a little bit about Senior Brown Bag. It's slightly different from a CSFP in a couple ways. One is the eligibility guidelines for age. Seniors have to be 55 or older to participate in the program. So we've kind of widened what is considered a senior in order to allow more folks to participate in our program. They have to be a resident of either DC, Maryland, or Virginia. We have programs in all 3 states, and so I'll talk a little bit about that in a minute. And their household income has to align with the eligibility guidelines outlined by TFAP, which is managed by DHS in Maryland, DC Health in DC, and VDAX in Virginia. So luckily, with our proposed rule change right now, hopefully in Maryland, they'll raise the income eligibility to 185 or higher. Right now, in order to qualify, they have to meet 50% of the federal poverty guideline, or they can qualify for a program like SNAP, TANF, energy assistance, medical assistance, and a couple other programs. So a lot of seniors do end up qualifying for this program through one of those associated programs. And next slide, please. So what's in the bag? The name Senior Brown Bag, obviously there has to be a bag involved, but there's 2 distinct components to this program. One, of course, is the bag, which it contains mostly shelf-stable goods. So things like rice, pasta, canned fruits and vegetables. Sometimes we get canned protein like canned salmon, which is popular with our seniors, and other shelf-stable items like milk. That can be provided in a bag form that's packed at the food bank by our volunteers. And then the other portion of the program is case lot commodities. So that's typically where you see our frozen protein and our fresh produce. We offer about 22 pounds per senior per month through our program. And the food streams kind of vary. About 90% of our food most months is through TFAP in Maryland. That's provided through DHS. We also do use some purchase product. We also benefit from those produce boxes from the DHS grant. So for the next couple months, our seniors will be getting produce boxes along with the rest of their food, which is great. They're really popular with the seniors, like Michelle was saying, and really great for portioning out for folks who may live alone. Of course, we have all the fresh produce, and then we also do have some donated items that come in. So that's typically what makes up a Senior Brown Bag every single month. And the sites that receive our program receive enough bags for every single person to get one, and then a case lot amount of produce that's kind of right sized to fit the amount of people that they're serving. All right, next slide, please. And I'll talk a little bit about how we're currently reaching seniors throughout the entire program, and then I'll talk a little bit more specifically about Maryland, since those are the folks that I work with most often. So these are our numbers as of this month. We're serving about 3,730 older adults throughout all 3 regions. 835 people in DC, 619 in Montgomery County, 1,313 people in PG County, which is our largest region, 208 in Arlington, 689 in Fairfax, and 66 in Prince William County. A Senior Brown Bag typically provides about 8 to 10 meals per month based on what is sent. And our sites range from community organizations and senior living facilities, residential complexes, to faith-based organizations. So I would say in Maryland, we have 36 sites, 18 in DC, 13 in Virginia. 11 of those Maryland sites are in Montgomery County, and they're all residential, including the Charter House, which I mentioned earlier. And sorry, lost my train of thought. Yeah, so those seniors are receiving our program delivered to their buildings or their community organizations every single month. So that's kind of how the current program works. Folks sign up and then they're added to a roster, and then the food is allocated for them the next month and is sent to their site. And next slide, please. So now we've kind of talked about what Senior Brown Bag looks like right now. And Marion mentioned a little bit about kind of where we're going. The program was established in 2002, and we're really trying to meet the needs of seniors as they evolve. So out of our planning process over the past year, we've come up with kind of 2 different pilots that are hoping to meet the needs of seniors. The first one is Senior Choice. This one is currently working out of our current Senior Brown Bag sites who were invited to participate in this pilot. It's a monthly market style distribution model where income qualified participants can select food based on personal preference and dietary needs. This is a change from our current program since, like I mentioned, the amount of bags sent are right size for the amount of people on the roster, as well as the case lot items. And everybody takes a bag and they take their case lot items and they go on their merry way until the next distribution. But we were hearing more and more about, seniors wanting a little bit more choice about what they're getting. And we're also really interested in being able to prevent further food waste at our sites, especially when it comes to items that maybe are not nutritionally appropriate for the diets of some seniors or culturally appropriate. So we're really just looking to offer more choice as to what they're getting. So this program, Senior Choice, eliminates the packed bag, and all of the items are sent case lot. So they're still the same elements, that shelf-stable goods, those frozen proteins, and the fresh produce, but they're set up in a market-style distribution, and seniors can walk through and shop for what they would like. There's a limit on the number of items they can take based on how much was sent and how many seniors live or come to that distribution. But we've really found over the past couple months, where I think we started this back in April was our earliest one back in Virginia, that seniors are more interested in this model as it provides them more choice. It's currently operating out of 2 brown bag sites in Virginia, Lake Ridge Fellowship House and Hunters Woods Fellowship House, and 1 site in DC, Salvation Army. So those are our current brown bag sites. We're working with DHS right now to bring this program to our sites in Maryland. And we're really excited about it. And then to talk about the next pilot program is called Silver Market. And this is probably the biggest deviation from what we're currently doing with Senior Brown Bag. What we've been hearing a lot, and I'm sure you folks hear a lot out in the community as well, is that seniors are really, really interested in fresh produce, and that can be kind of difficult to find. And they're also really interested in frozen protein. And so what we decided to do for Silver Market is offer that on a large scale. So Silver Market is a monthly indoor, also a market style distribution that on a large scale that focuses on providing specifically and only fresh produce and frozen protein. We're interested in doing this to continue to support client choice, but also nutritional needs and the preferences of our clients. So seniors can qualify for Silver Market the same way that they qualify for Brown Bag. They have to be 55 or older and meet that TFAP income guideline. And we're currently working with UPO-PD Green in DC and serving an average of 200 to 250 people per month through this program. We've also integrated service insights into this program. So people have cards, and so there's no need for paper rosters, and all of our data collection is done online, which has been really, really great. And so we started this market in July in DC, and we're really, really excited to see how it's evolving. You can see one of the pictures I have at the bottom. That's the lovely volunteers at UPO talking to one of our seniors during a Silver Market distribution. And up top is at Hunters Woods Fellowship House during one of our Senior Choice distributions. Again, just like Silver Market in DC, we're really interested in bringing this program to Maryland. We're working with DHS to make that happen. But, UPO PD Green has been really great providing, volunteers and staff members who are dedicated to get this up and running. We have not been able to do it without them. And we're really excited to see this continue and spread out into DC and Virginia as well. And that is all I have for Brown Bag today. I think the next slide, I will pass it back to Marian.
Thank you, Michelle and Cece. Wonderful presentations. Here is our contact information. So if you have any additional questions you want to address with us, you can send us, call us or send an email. And I think we have some time to do questions now, Emily. Okay. So
Thank you. Yes. First of all, thank you to the whole team for an amazing presentation. I think we realized when we were speaking, it had been more than a year since we had the Capital Area Food Bank join us and discussed specifically programs for seniors. And it worked out very well because it seems like there were lots of great updates to share. So this is great. I'm seeing in the chat, Pat Drumming had a question for how do seniors sign up for the program in White Oak?
Yes, I can answer that. The White Oak distribution is the third Thursday of every month. So we will be there on, sorry, I'm looking at my calendar, the 21st, from 10 to 12 in the parking lot at the White Oak. You just look for the Capital Area Food Bank truck. All a senior needs to bring is an ID that shows their residency and age, or if they don't have like a state ID, birth certificate, and some sort of utility bill is fine too. But people can sign up right there on the spot. We do accept walk-ups, yeah, if that answers the question. I did see something about Germantown as well.
Yes, that was if there are any 55 plus grocery delivery available in the Germantown area.
Cece, are there any senior brown bag locations in Germantown area?
There may be a couple that I can send the information for. If you'd like to reach out to me with your through my contact information, send me an email. I will say as far as Montgomery County and Senior Brown Bag as a whole, we don't have the capacity for home delivery through DoorDash like CSFP does. But there may be some sites in the area if the seniors that you're looking for have a proxy, friend, family member who is able to go pick up for them. That may be something that we can make available to you. So I'd recommend reaching out to me through my email, and I can send you some of that information about sites in that area.
Great. Yeah. And if there's any flyers for any of the sites, please, Capital Area Food Bank team, feel free to send that to me and we'll send that out in our follow-up notes. I apologize. We have a lot of questions in the chat, but we're also running a few minutes behind. So I'm going to ask if the team wouldn't mind trying to answer those in the chat, and we'll keep moving forward with our presentations because I just want to be mindful of everyone's time. But thank you so much. Really great presentation. I am going to turn things over now to another one of the, large programs in Montgomery County serving seniors, and that is Montgomery County's Senior Nutrition Program. And we're so thankful to have friend and member of the Food Council, Marla Kaplan, join us today to speak about those programs. So Marla, I'm going to turn it over to you.
Thank you, Anne Marie. Do I need to share the slides, or can you share the slides and then I'll drive them?
I am happy to do that. Just give me a second, but you feel free to take it away and I will bring those up.
Hi, everybody. I've noticed there's so many familiar, friendly faces on this call. It's nice to see everybody. So I'd like to talk a little bit about the senior nutrition program here in Montgomery County. As Anne Marie is pulling up the slides, just to sort of give you some background, the Senior Nutrition Program comes as a result of the Older Americans Act, which is something that was put in place in 1965. There's been several renditions. The idea is obviously to provide healthy meals for our seniors as they age and are less able to afford healthy food. In Montgomery County, we're also supported by our Maryland Department of Aging, as well as our senior nutrition program. And then we do accept donations at our congregate locations, and we'll talk about that in a few minutes. As cool, we've moved on. There are two types of meals that we support. One is our home delivered meals. Those are meals that are delivered to each person's home. In order to qualify for those meals to be delivered at no cost, there is an application, and basically the person that's receiving meals at home should not be able to shop and isn't able to prepare food at home. But we do provide home delivered meals throughout the county every day. The other big part of our program are our congregate meals. The mission behind the congregate meals, and this is where folks come to a location and receive a meal every day that location is open. Besides the folks getting a nutritious meal, the idea behind the congregate meal is to promote socialization amongst seniors. And we learned that in COVID, what a struggle and what a horrible encounter that many seniors had when they were isolated. So this really serves two purposes, and I'm not even sure which one carries more weight. So we serve in congregate meals in our community centers. I noticed on the slides that were shown, like Arcola is one of the sites that Capillary Food Bank delivers to. It's also one of our community sites. We provide congregate meals at senior housing, adult daycare centers. And then there are culturally appropriate meal providers that don't receive the food from the senior nutrition program, but we fund the work that a restaurant provides to them. And there's a whole vetting process and contract process through that. And I'm happy to provide more details, but in the meantime, just so you know that there are culturally appropriate providers that provide meals as well. There we go. For our home delivered program, these are the locations these are the organizations that provide our home delivered meals. Basically how this works is that the meals are taken charge by these various locations, and then there are volunteers or folks that deliver these meals to individuals' homes. And come on, slide, you can do this. These are the locations where we provide our congregate meals throughout the county. And then we do have two city-operated senior centers, which are the Rockville Senior Center, as well as the Benjamin Gaither Center. In order to receive a meal at these locations, the senior needs to be 60 years of age or older, and needs to register to be part of our program, which is a very simple operation. They need to provide information, no income information, but a little bit of demographic information and a little bit about their abilities. And once they're registered in the program, in order to get a meal, we have a system in place where seniors are required to reserve a meal in advance. I'm not going to get into all of that right now, but meals are ordered based on reservations that have been made by seniors. And once you're registered in the senior nutrition program, a senior can attend a meal site anywhere in the county. However, as I said, the meal has to be reserved for in advance. And, you know, seniors come and they have a meal and enjoy the meal. There are rules that accompany this process. For instance, meals cannot be taken off grounds, and that's for safety and food handling kinds of regulations. But seniors tend to come, they come to the same site generally. They have a group of people that they congregate with, they eat with. We hear all the lovely comments about the meal, why they didn't like it. But by and large, the seniors are enjoying a meal each day when they come to the senior sites. Again, these are these are additional locations that we provide meals to. And then we have the Chinese Culture and Community Service Center as one of those culturally appropriate meals that senior nutrition program supports. This location contracts with a restaurant that we have vetted to make sure their health department requirements have been met and their menu is as it needs to be to meet the requirements. But they do their own ordering in their contact directly with a culturally appropriate restaurant. Again, more the congregate meal locations. The one initiative that was started several years ago, and this came out of the pandemic, was the restaurant initiative. And this is a program that provides, I think the best way to describe it is a special meal to either a home delivered location or one of the congregate locations. And it's kind of a win-win because in a sense, we are providing revenue to a small business that is wanting to work with us. The restaurant knows the requirements of our program: 3 ounces of protein, 1.5 cups of fruit and vegetable, grain, hopefully whole grain. And they are then hired, if you would, to provide a meal that we work with them to determine that meal that is special. So we work with African restaurants, we work with Italian restaurants, we work with Vietnamese restaurants. So the idea is to bring in a healthy, culturally diverse, tasty meal either to the homebound seniors or to seniors at the congregate locations. And what we hear anecdotally is that they realize how much that we care about them. Senior nutrition program, we don't decide what ethnicity we're going to bring to a location. We work directly with the site and we ask for their help in to determine what a meal preference for that location might be. We have done fajita bars, we've done taco bars, and the seniors really do enjoy it. But as I mentioned, it's a win-win because it's generating additional revenue to restaurants. This started for us, it started as a result of the pandemic when we did this through the Food Security Task Force. And it makes the seniors recognize the fact that we really do care and we do really respect the fact that they do want some culturally diverse meals. And how do we pick the restaurant? So if you know of a restaurant, let me know. First of all, not every restaurant wants to work with us, go figure. But we don't work with chains. We work with small mom and pop type restaurants. And by the way, anecdotally, during the pandemic, through this program, we have many restaurants that said this is how they survived. So we don't try and as far as the meal per cost, we don't try and nickel them down to an amount that they can't afford to serve. We want it to be a win-win. We want our seniors to enjoy a restaurant meal, and we want the vendor to be able to earn money as a result. And so our meals run from anywhere from $12 to $15, $16 per person. as I mentioned, we work with a small restaurant, a mom and pop kind of restaurant, not a chain. First thing is, I review their health department reports. If there's repeated reports of vermin or rodents, like, no, sorry. If there are repeated reports of food handling issues that tell us that they're not up to standard, no. So finding a restaurants initially that meet the criteria that are acceptable to us is key. And then approaching the restaurant and having them desire a relationship with us, which I will tell you that most restaurants do want to work with us. And then in the initial meeting, we talk about the meal requirements, we talk about packaging, we talk about the delivery and the fact that the meals need to be hot when they come at the correct temperature or cold, depending on what the meal is. And we get this ball rolling, and then we determine a price. So it's not a standard price for all restaurants. It's based on their location. They do deliver their location, the type of food that they're providing, and that a meal price is determined, and then they are then I go and I get a purchase order for them so that we can begin the meal delivery process. It works, which is really kind of nice. Trying to change the side. So this program has been incredibly successful. The restaurants really are excited to support seniors. One thing I didn't mention is the restaurant is required to put a label on each package that they deliver. And it serves as a marketing tool for the vendor, for the restaurant. They need to put a date on it. We all know that seniors could be a little bit forgetful, and if it's a home delivered, put the meal into the refrigerator, and without a date may lose track of when that meal was prepared. So it needs to be labeled with a date, with the location, and with the contents of the package. We provide every day at all of our locations a hot, a vegetarian, and a cold meal. And our restaurants are required to assimilate to the same kind of meal service that they're provided to at our congregate and our home delivery sites. That's our restaurant program. If you have any questions or need additional information, you can reach out to me. This is my email address, or our director, Carol Craig, who was not able to be with us today. And this is our director, and that's her email information. So I'm happy to try to answer any questions, but I know for the sake of the conversation, Anne Marie, you want to move on. I know
Well,
that.
first of all, thank you so much for a great presentation. I think we could all benefit from labels on food in our refrigerator. I don't think this is limited to seniors. I think many a Friday rolls around in my house, and I'm wondering what night did I make this thing that's sitting here, and is it safe to eat? So that's a great thing. Anyone have any questions for Marla if you have any questions about Meals on Wheels, we actually have a number of Meals on Wheels or other senior delivery programs on the call today, and we are going to take some time with each one of them to hear about their program. But if you have any other questions for Marla about the congregate meal sites or the restaurant programs, feel free to put those in the chat, or to raise your hand. That would be great. Okay, I am going to start looking in the chat, but in the meantime, I know that we do have folks here from the Gaithersburg Meals on Wheels, from Food and Friends, from the Jewish Social Services Agency, and from the American Muslim Senior Society. If I forgot anyone, please raise your hand and let me know. But if not, I'm happy to kick things off. Paula, I did see your camera come on. If you wanted to introduce yourself and a little bit about Gaithersburg Meals on Wheels, welcome.
Hi. Okay, so Gaithersburg Meals on Wheels, we've been around since 1981, and we serve a 3-mile radius from Asbury Methodist Village. So that's Montgomery Village, most of Gaithersburg, Washington Grove, and small parts of Durwood. We deliver a hot meal and a cold meal. Our subcontractor is Asbury Methodist Village Kitchen, so it's a professional kitchen. We have 80 volunteers and about 80 clients. And no one's paid. We haven't paid anyone since we formed over 40 years ago. We before our price went up from our vendor, we had maybe about 20 people out of the 80 paying, and then the price doubled from $6 a day to 12, and now we're down to about maybe 4 people who can pay the full amount. So we need to get our funding elsewhere. And I just took over in July. I had been a driver and then what we call a dispatcher, which is the person who some people call them the day captain. So my question to people is, how do you get people to do this? I mean, I'm working 20 hours a week as a retired person, and I'm trying to get someone else to take over this job and go back to being vice president. So now we don't have a president or a vice president. I do have a couple of volunteers who have stepped in, and we've chopped up the job. But my question to you all is, who gets paid? And if you don't get paid, how did you ever find a replacement? And if you want to know anything more about Gaithersburg Meals on Wheels, let me know.
Paula, thank you so much for sharing. Those are big questions, but I welcome feedback from anyone. In the chat, I see Jenna did share asking if any of the local Meals on Wheels chapters have ever thought about consolidating. So I'll just for the benefit of that, read that aloud. So something, but thanks for ideas from the community, and certainly things to think about. Again, I'll leave the chat open for that. Kara from Jewish Social Services Agency, I know that you're a little time pressed, so please, why don't you go next? You or Taylor about the programs?
Yeah. I can jump in and just start, and then maybe Taylor will fill in the gaps because these are her programs. So my name is Kara Pokras. I am the Director of Aging in Place at JESSA. I just started in July, so these are all new programs to me that I'm learning. We do also have a Meals on Wheels program. And Jenna, yes, just after Paula's presentation, I am now thinking that consolidation might be a good idea and that maybe we could help. So that's that. Okay, so we do Meals on Wheels. We have in Rockville, Bethesda, and I know we also deliver out in Clarksburg. Right now, we have 68 homes that we deliver hot meals to. They get meals we don't deliver every day, but they get meals 5 days a week. Eligibility should be the same, right? Over 60 live in Montgomery County, homebound, and we also provide kosher food. So that's kind of our specialty right now. All of our meals are made at the Hebrew home, so they are kosher. Our Clarksburg group does not necessarily need kosher food, but they kind of got lumped in with us. So that is what they get. We also just got a bit of an extension to serve another 8 households, and that will be really focusing on kind of an age gap for 55 to 59-year-olds, where they aren't getting the funding for over 60, but some people are still very much in need. So that's where that money will go. And the other food program that we have is, we call it ADIS. It's our ADIS Israel program. It is also a congregate meal program. So somebody else was presenting kind of about that, getting together for socialization and meals. So we partner with ADIS Israel. It's right off of Connecticut Avenue, just over the DC line. So it's a DC meal program. We do 5 days a week, lunches, and then social activities, both before and after lunch, and outings. Those are our programs.
Thanks so much. All right.
You're welcome.
APSA. from Food and Friends.
Hi, thank you. Yeah, so hi, nice to meet everyone. I am from Food and Friends. And so we are an organization that doesn't necessarily focus on serving seniors, although most of our clients do tend to be seniors because we deliver we home deliver medically tailored meals and groceries to people living with chronic illnesses. So if you think about like HIV/AIDS, cancer, diabetes, cystic fibrosis, ALS, multiple sclerosis, so like those kinds of illnesses. And so we just have like a large percentage of our clients happen to be seniors, even though we don't have any age insurance or income requirements. And so probably in like Montgomery County, we serve about, I pulled the report today and I did everyone like 65 plus. And so 84 clients right now in Montgomery County are 65 plus. And so the referral process is pretty simple. Like if you just were like to go on our website, which is foodandfriends.org, you can find our intake form there under client services. And so we just ask that someone's like licensed medical provider, whether that be a doctor, case manager, social worker, refers the client to our services. And then they'd be able to get on our program and receive our like medically tailored meals, which are prepared by our dietitians and our chefs in-house. But if anyone has any questions, I'll drop my email in the chat. But yeah.
Thanks, Elsa. And last but not least, Faiza from the American Muslim Senior Society.
Hi, I'm glad to meet all of you today. I'm the program coordinator for the American Muslim Senior Society. We provide services to the seniors age 55 plus. We provide them with hot meals served to their doorstep, including the produce and dry goods twice a month. And regarding what someone mentioned about the volunteers, I guess it's a struggle to find volunteers who will be able to do that. In addition to the food, we also provide them with wraparound services, phone calls, friendly phone calls, and check with them on a weekly basis about their needs and try to manage how can we provide them with whatever needs and services that AMSS can provide to these people. We have over 120 clients, and our volunteers number varies based on who's available and who's not available. All these requires a lot of coordinating and managing to have them available at the day of the delivery. And I'm gonna put our website link on the chat. So if you would like to visit our website, learn more about the American Muslim Senior Society, I will be more than happy to do that.
Thank you, Faiza. Are there any other providers that I missed who were able to join us before we shift the conversation a little bit? Okay. All right. We have 10 minutes on the agenda to really kind of talk about any other questions that anyone on the call might have about the senior food resource space. So I know a lot of information was shared today. There's a lot to take in, but I think this is a good time to kind of talk about where do you still see gaps, even with, all of these programs that are happening, are there providers on the call that are serving seniors that are not aware of these resources, that are experiencing barriers to accessing any of these resources that we'd like to discuss today? Happy to make some space here for that conversation, or further on what Paula raised about just the nature of capacity in volunteer organizations serving seniors.
Well, one thing I did it's not just volunteers, it's not just the drivers, it's like the management. I mean, managing 80 volunteers and 80 clients who are, the driver gets sick, the client, oh, I got a doctor's appointment. Can you deliver it before 11 o'clock? And the calls, the messages, getting the drivers to come try to use, computers aids when some of my drivers are in their 80s. So it's more of like, how do we keep an organization going with the people who have to manage it? I mean, are we, and that's kind of been our dilemma. I mean, who retires and then wants to work 20 hours a week, to volunteer 20 hours a week, which is about what it takes. How do we have to start paying people? Should there be a fund somewhere to help us with management? Should there be a computer programs and iPads available to Meals on Wheels organizations so we don't have to worry about that aspect? Someone can take care of the database systems for us. Is there a way to get that kind of support? That's kind of what I'm throwing out there. I'm kind of, I have a business degree and I'm a supply corps officer in the Navy. I'm retired. Plus I had other jobs in between. So I'm thinking of sustainable business model. And if I had this as a case study of a sustainable business model, I would go, what? So anyway, anyone wants to throw in there?
I mean, I think we at the Food Council wish we had a magic wand and could solve these problems. I think like this is why we're here, right? And our plans for the future in this space is to really focus on solving these kind of problems as a larger group, trying to get smaller groups to come together to have those more bilateral conversations so we can try to figure this out. So I'm here to be so unhelpful in providing any useful information to you right now, but just know that if you continue to come to this space and we continue to engage around these questions, that we will make incremental progress.
These are all great programs, but there is a big swath of Montgomery County geographically that is not served by them. WMCO serves the western part of the Ag Reserve in Poolsville as well. And there are rural seniors in our county that cannot access these services. There is no Meals on Wheels. There is nothing. And WMCO, we do the best we can, but we already do so very much for our part of the county and could use some help, including. So with the Food Council calls, I'm always like, okay, I'm going to come on the call and hear about what's happening in the rest of the county. And that is true 90+% of the time. So just a reminder, I feel like that's my job a lot of the time to say, we do have rural residents and they have needs, and we do have rural seniors and they are very isolated. And so anything we can do to remember and help them is appreciated.
I will
Michelle,
say too, oh, go ahead.
No, I was just going to say, Michelle, I know that you were, Katie, I know this doesn't answer your question about a prepared meal, but Michelle, I know that you were looking to connect with more clients that needed home delivery in Montgomery County. So maybe at least that's a first step. And I know that, I'm not sure, again, I know different programs have different funding streams. And so I don't want to make assumptions about what's available in one could be available in the other. But I know when we met prior to the call, you were saying too that there were some adjustments that could be made in terms of the level of the produce, like how pre-prepped some of that might be in some of the options. So I just wonder if there's an opportunity there for providing, something that's a little more not in the fully raw state, I guess I would say, and that could be an option here.
Yeah, anything would be appreciated. I'll put my email in the chat.
I was just going to say to Dana's point in the chat about a referral location, our SNAP team does take referrals for general food assistance as well. And I'm going to commit to some things we're going to do that people here don't know about yet, but really putting all of this information on our website in a way that's easily digestible. So you have all of the senior nutrition information, but know that you can always call our SNAP line if you have someone. And, we do what we can just with the knowledge we have about the network and who's available. So it's nothing magic, but at least it's a place where someone can talk to a human being who knows where these resources are and can help intervene.
Yeah, I was also thinking with some of these varying program requirements, there may be an opportunity here. I don't want to make promises on how quickly we could get something like this out, but I am envisioning at least a spreadsheet of kind of, whether it's 55, 60, 65, whether it's, delivery, how you qualify, whether there's an application involved or an appointment involved. And maybe we could put together a resource like that and share with the group. So at least you have something to kind of sort through, based on the need of your client. Okay.
Excuse me, Anna, can I say something?
Sure, sure.
Okay, I just want to make sure that the organization is called American Muslim Senior Society, but we're not limited only to Muslims. In Montgomery County, we provide services to anybody and everybody as long as they meet the criteria, which starts with the age 55 and plus.
Thank you, Liza. Thank you. Okay. We are back on time, but again, happy, if there are any other questions, I've definitely, I've seen information in the chat about the difficulty with getting volunteers. Yeah, so that, still an ongoing issue in our community. I've heard recently that someone was supposed to be coming on board soon in the volunteer center, so we will try reaching out there again. I know for a while that position had been vacant, so we can check in to see what's going on in that space and get back to you with what we learn. Before we turn things over for our OFSR update, Heather, I see you. Thanks for joining us. We are just going to do our quick poll on the resources that were shared here today. So if you wouldn't mind just taking a moment to complete that, we appreciate it. And just again, another huge round of thanks to all of our speakers today, from the Capital Area Food Bank, Marla from the county, all of our different Meals on Wheels and other delivery meal programs who are joined. Really appreciate your time and all of the work that you do serving seniors in the county. So thank you. I'm just gonna keep that up, but in the interest of time, I'm happy to also turn things over to Heather for some updates from the Office of Food Systems Resilience.
Thanks so much, Anne Marie. No real formal updates this afternoon, other than it's terrific to be with all of you, and thanks as always for your service in our community. As many of you probably have seen already, our team is diligently working through, in partnership with the Office of Grants Management, processing the decisions of the Community Food Assistance Grant Program. Huge thanks to Catherine Nardi in particular for really going through all the administrative hurdles required to get those announcements out the door. But for grantees, there is an info session this Friday. And so if you have not received information please make sure that you're in, and you did apply, please make sure that you're in communication with our office. And also not just for community food assistance grant partners, but also the broader community. Our team is launching a new initiative called Community Connections, where members of our team will be available for 15-minute appointments for technical assistance, questions, ideas, feedback, in an effort both to be accessible and collaborative with all of our community partners. So want to make sure that you all know that those opportunities are forthcoming as well. And so stay tuned for more information. Related to the CFA grant decisions, I think we've shared this before, but it is a really challenging time budget-wise for the county, with a lot of decreases in federal assistance and federal funding for a lot of the food security programs that we had been operating for the past many years. And so though we had originally hoped that there would be $7 million in the FY25 budget for this program, in the end, we only had $3.5 million. So unfortunately, there were no applications that were able to be fully funded. And it was a really difficult process to try to stretch those dollars as far as we can, and just want to make sure that we are, transparently communicating that we really critically appreciate and want to support the work that our partners are doing in feeding our neighbors, and thank you for your ongoing partnership, and happy to continue conversations. But as the FY26 budget processes unfold, you've probably already heard about the county executives budget hearings. I know that the Maryland General Assembly has, in a couple of weeks, their Montgomery County delegation community priorities listening session. So as opportunities come to share your voice about what is important to support through both policies as well as budgetary investments, I encourage you to take advantage of those opportunities and share your expertise and the needs that you see that are currently unmet or growing in the community. So thanks, Anne Marie, for the chance to get to be with everybody today. But please feel free to pop any questions in the chat box, or as always, reach out with questions, comments, suggestions. Have a great day.
Thanks, Heather. And speaking of policy priorities, again, just going back to something that Capital Area Food Bank raised during their presentation of potential, changes at the state level that they would like to see. Please do let our groups know if there are any opportunities for advocacy on those issues, to, expand senior options in Maryland and Montgomery County. I'm sure a lot of organizations would appreciate the opportunity to hear about that. We do have our food systems advocacy call as well. That could be a place to connect on those issues. So I think just being mindful of, fewer county funds that are available, fewer, federal funds that might, be available in the future, and just kind of preparing for where there are opportunities for us to advocate for more resources. We certainly want to be mindful of those. But any questions for Heather or any of the other presenters for today? We have about 10 more minutes on the agenda, so happy to make time. So just checking.
So you have the time. Does anyone else who does home delivery, what kind of software do you use? Or what do you use?
This is Faiza from AMSS. Honestly, we do not use a software. We just use Google Sheet and Excel sheet. Very basic to track our activities.
Yeah, that's what we're doing now. And because the ones I saw we've looked into are very expensive.
Yeah, you're right.
Does anyone else use anything else besides Excel and paper and?
Rockwell Help still uses index files, so we're behind you. Yeah.
Paula, I wonder, Food and Friends, I know that they had to leave the call, but that's someone that we can reach out to and certainly ask them for what they use as, you know, kind of a larger organization. They might have, some input to share on that. Yeah, I think the challenge is, you know, there are a number of providers like, that are partners with Capital Area Food Bank. And so having that kind of backbone organization that has a, you know, a data collection system itself, like Service Insights, and, you know, obviously the Meals on Wheels group doesn't, you know, I'm not familiar with, you know, any, like a national organization or something that you might connect with, that might have resources like that.
Paula, are you talking about like logistical dispatch and scheduling kind of software? What are the needs that you have?
Yeah. I mean, I know Rockville Meals on Wheels uses Zippy Drive, and it was developed by a small Meals on Wheels couple who custom made it. So yeah, you put in all the addresses, it optimizes the routes. When you have our biggest problem are those instant changes. Oops, you know, so we just added someone, someone's in the hospital, they just got back midweek. You know, people, oh, wait a minute, now I'm in the hospital. I'm in rehab, I just got out of it. So there's just a lot of changes to the route. And so we're trying to optimize the route and be timely with people without having to physically pull things in and out of folders or have to go into the office to do it. Although we do have a daily dispatcher now who does it. We went from index cards to 3.5 by 8.5 and by 11 in a notebook. So maybe we made some progress. And we do have a retired program manager who has linked together a number of Excel sheets. But, you know, I'm just looking for something more down the line that's going to be a little bit better. My other question is, when you qualify your clients, how do you get people with dementia who don't seem to have much help, or, you know, how do you go about interviewing them?
This is Faiza again from the American Muslim Senior Society. Usually we have our ambassadors. As soon as we get the application, they are the one who will interview the client. Some of them, we do have a couple of clients that they have dementia, and they go physically to their house and do the interview and work with them, fill out the application, do the paperwork, make sure they are eligible. And of course, you know, they have some family members who can help in this process.
Okay, and I guess my last one is, so if our drivers see something's a little off with someone, we had called protective services on someone, and then the client objected that we had done that without talking to them first. You know, what kind of guidelines do you use for calling adult protective services? Most of our clients, it's not from someone else, because most of our clients live alone, but they're usually neglecting themselves to the point of a real concern. How do you guys handle that?
For us, when the need arises, I do call the health and wellness check, but I never came across a situation where the client did not accept that. I don't know if someone else experienced something else. I do not know, but this is our personal experience.
So I'm sorry, you called the Department of Adult Protective Services or someplace else?
Honestly, I do not know what is it called, but as far as I know, it's called Health and Wellness Check. I think the number, let me see. I can't remember the number that I called, and I don't have it in front of me, but Let me see. Let me try to look it up within the next couple of minutes.
Okay, while she's looking into that, happy to take any other partner announcements or questions. I will say for December, just please hold on your calendars our scheduled meeting time of December 9th from 1 to 2:30. That's the second Monday, returning to our normal schedule. No Monday holiday in December, so we'll be meeting on the 9th. We will send out more information on that shortly as to what the focus of that meeting will be. But that being said, if there are no other questions or comments, happy to give you a few minutes back in your day. And again, just a reminder, if you are aware of any providers other than the Capital Area Food Bank or ones that have already been mentioned in the chat that are selling boxed produce. We are happy to collect that information. And again, I will share the information in the follow-up notes about the holiday giving program and the zip codes that still have families in need, where they're still looking to match families to resources for Thanksgiving.